Go.
Hi, I'm Vince Schoenfeld, physical therapist and co-owner here at Rocky Mountain Spine and Sport. This is Mark, a patient of mine who we've been doing some dry needling on his neck. He was in a motor vehicle accident about 1.5 years ago. He's rear-ended. He had headaches, pain in his neck, numbness and tingling in his left forearm and in his ring and little finger on his left hand. And he had physical therapy at another location and was sent to me for dry needling since he kind of plateaued with his condition. We started doing some dry needling into the subcranial area, the suboccipital muscles in the base of the skull, and he's had incredible results. He is no longer taking his pain medication. He doesn't need sleep medication in order to sleep, and his headaches have been gone since he started dry needling. It's been quite an incredible result that we've achieved with him. So dry needling is essentially the use of acupuncture needles, and they're very fine monofilament needles which are very thin and bendable. They are inserted into muscles, tendons, connective tissue in certain areas in order to elicit a healing response in those tissues. There's also been evidence that there is a cortical changes in the brain which affects the interpretation of pain, and it can eliminate pain. So anyways, we're going to start here by placing some needles in Mark's neck just to show you the treatment which we have been using. We're going to start off by going into some of the muscles right along the vertebrae in the neck. And as these needles are entering the skin, oftentimes you'll feel a small little prick sensation, a little bit uncomfortable. There's nerve endings in the skin which are sensory, which allow you to feel pain, and that once it gets deeper, that diminishes some, and you may start to feel a slight toothache feel as it goes deeper into the muscle, which is essentially what we're trying to elicit. We want to have a response such as that. After we place these needles in Mark's neck, we will hook up electrodes to some of them to use what's called electro dry needling, which helps to further elicit an analgesic or pain relief response. And it's been real effective with Mark, obviously, pretty much clearing up his headaches completely, allowing him to sleep. He's not having the pain that he was having that had been that persistent for so long. And oftentimes, this dry needling is very effective in chronic conditions, such as cases that are older than 90 days, or we often use it more for just cases that have been lingering for more than 30 days. And we're going to go right over here off to the base of the occiput, the base of the skull. Go right into the tendinous insertions from some of the cervical or neck muscles on both sides. And just 2 more here. You doing okay, Mark?
Yep.
Okay. Okay. Now I'm going to take my electrodes and connect them to some of the needles on each side. And when I say some, we'll kind of encompass some of the needles that are in between the two that are connected to the wires. We have these little clips that just clip right around the hook, right around the wire, to ensure a good connection there. Okay. Okay, Mark, I'm going to turn these on. You just tell me when you start to feel it, and just tell me when to stop, when you can take it up as high as you can comfortably tolerate it. You okay there?
Good.
Okay. And then the other side? How's that?
Good.
That good there?
Yep.
Okay, all right. So we will leave this on for about 15 minutes, and I leave him with a bell, obviously, so he can ring for me if he needs to call me for any reason. But this effect has been shown to have an increased analgesic effect or pain relief, which has been great. It's worked great for Mark. So dry needling is a very effective treatment, as I said, for more chronic conditions. It works very well for neck pain, headaches, whether it's migraine, cervicogenic, shoulder pain, shoulder impingement, tennis elbow, carpal tunnel syndrome, low back pain, hip bursitis, knee pain, knee osteoarthritis, plantar fasciitis. The list goes on. It's very effective, been shown to be a very effective treatment in that. So anyways, just wanted to share that with you. If you have any questions, you can feel free to reach us at the telephone number or on our website that's listed on this video. Thank you very much.